Danny Sands again here. So our next introduction is that we have a little change in the program, but it's still going to be really cool. So it's the same company. We have a special demonstration. The company is BioBeats. BioBeats. So we need some drums action here from the sound guys. BioBeats, machine learning for human well-being. And rather than David Plans from BioBeats, we actually have the COO from BioBeats, Andrew Atwell, who is a professional with over 20 years' experience in the health and life sciences industry at all stages, from product development to market launch and growth. A pioneer in the digital health vertical with over 8 years of experience. Expertise in early-stage venture capital investment, business development, alliances, sales and marketing, strong scientific research and product development background, and a very large professional network. Experience working in entrepreneurial environments, large and small enterprise companies. So with that, I will turn it over to Andrew Atwell from BioBeats. Give it up.
Hello. So I appreciate people sticking around towards the end of the day. I have talked to the caterers, and they're not going to serve any drinks until I'm finished, so you might as well stick around. But what I hope to do today is show you some interesting demonstrations of the technology that we've built at BioBeats and how we're addressing the challenges of stress on people's lives and on the workforce. So BioBeats is a company, we started in 2012, so we're actually a pretty young organization. But what we do is we have cloud-based machine learning platform where we get biometric data from consumer-grade wearables, and we're able to analyze that data and quantify improvements in an individual's response to stress. The problem of stress, lost my slides. Great, thank you. The problem of stress and stress in the workplace is one that is quite well known, most often counted by days of lost work, but also now in healthcare costs that are carried by the employers. But what's really telling is it's really being considered the silent killer now. So this story came out in the Washington Post just yesterday. I was really pleased to see it. A study done by Stanford and Harvard that's actually quantifying the number of years in a person's life that are actually shaved off if they are working in a high-stress environment. And stress can come from a number of different avenues. It can be based on an individual's health. It can be based on the requirements of their job or the stability of their job. But the reality is it has to be perceived as a stress to the individual. So it could be any number of things. But what we do is we apply machine learning to the data that we are able to collect, as I mentioned, through wearables. The importance of it going up to the cloud is it allows us to do this analysis in a closed-loop biofeedback system in order to create contextually correct and personalized interventions for individuals to have the greatest efficacy. What we look at is the heart, we look at respiration, and we look at activities of an individual. When we're looking at the heart, we're specifically looking at heart rate variability. So as opposed to pulse, which would be the number of beats your heart takes within 60 seconds, heart rate variability is actually the time between individual beats. So what we're trying to track here is actually cortisol levels in the blood that relate to the brain's response to stress. But it's very difficult to take a blood test and look at cortisol levels. But cortisol has a direct effect on the heart. And so measuring the activities of a giant muscle that's pounding away in your body, both physically and emitting electrical signal, the problem becomes quite easier. So once we've collected that information, we've processed it through our systems, what we're able to do is then provide interventions based on clinical proven solutions. So we focus primarily on mindfulness, meditation ideas, as well as breathing exercises, and providing other tools for individuals to understand where their stress comes from so that they can avoid those triggers or that they can sort of head those things off before they become overwhelming to the individual. So we're providing insights and coaching and tools for each individual. So when we were building our platform, and I think when you run into this, anytime you're trying to build an artificial intelligence or machine learning platform, is that you have a chicken and egg issue. And particularly for an earlier stage company such as ourselves, we didn't have a huge database to which to train our algorithms. And so what we did is we thought a little bit out of the box, and we designed an app called Pulse that we first brought out during South by Southwest about 3 years ago. And the idea behind it was to build a viral app that would be able to collect cardiac information from individuals and allow us to study it. So can we switch over to the Podium VGA connection? So I'm going to demo that right now. OK, so this is our app Pulse. You can take people's heart measurements. A lot of the things that have been on the market, you kind of have to sit quietly and take your measurement. But what we did is we decided to take your heartbeat and capture it using the camera on the phone and then turn that into music. And so what you're hearing is actually a soundtrack created by my own. Yep. Are we losing the picture? Oh, sorry. So this is actually created from my own heartbeat right now. So what we're able to see on the screen is both a visual media experience as well as an audio experience. And it does track with my heart rate. And over time, it becomes a bit more complex. So this was really kind of the viral catch that we needed in order to start generating this data. During the time of South by Southwest, we collected more than 100,000 individual heart rhythms from people that were just attending the conference. And because we had them log in through their Facebook accounts, we also had demographics and geographic information on them. And so what that was able to provide to us was a nice rich data set in order to train our algorithms on. So we'll go back to the presentation, please. What you'll see on the maps here are, on the upper right, are actually data points that we gathered as we correlated to people's geographic positions based on their Facebook profiles. And then below, looking at the World Heart Federation's report on obesity in the United States. And we saw a very nice correlation between those two data sets regarding monitoring where an individual would have obesity as a response to stress in their life. So we were really quite surprised with this, but it made us feel like we were on the right track to coming up with some solutions and understanding people's overall health, cardiac health, as it applied to stress in their life. So we went out then to start building some more valuable apps in collaboration with a number of partners of ours. So the app on the top there is called Bright Time. It was commissioned by Bupa, which is a large international insurance company based in the UK. And what it did is allowed individuals to check in routinely throughout the day, looking at their activity levels, encouraging them to take breaks and do some breathing exercises, as well as get out and take a walk. It might do something, if it notices you've been sitting at your desk for 2 hours, it might encourage you to stretch a bit. Or if it knows that's late in the day, it might encourage you to go outside and get some sunlight before the sun goes down. Below that, we have the example of our app called Get On Up, which was really focused on encouraging people to be more active and to move around. I've heard it mentioned a number of times already today, how sitting is the new smoking. But this is to allow you to have a soundtrack to your workouts. So what Get On Up does is it actually monitors your heart and your pace and adjusts your music so that it meets that. So you can actually do interval training where your soundtrack will increase the beats per minute to warm you up through your exercise, hold you for a period of time, and then slowly reduce those rates in order to cool down and finish up your exercise after you've attained the goal that you want to. We found that by feeling people were really engaged with their playlist and something they didn't have to build in advance, that it had a nice stickiness to it and people were really encouraged to continue using it. The other side of the coin is that all the data that we're collecting and is running through our cloud platform is actually available to be analyzed through a dashboard interface. What the interface shows you is that the measurements for people's stress and their response to exercise to reduce stress is actually quantifiable. And this has tremendous enterprise value. So it can be looked at as an individual level as well as a population-based level. So you can look at this as a tool in understanding where an organization like an insurance company or a large employer may want to drive interventions to reduce stress in the workplace, or where they may have the most negative effects occurring from stress. Here now is a current iteration of an app that we've built that's focused on driving relaxation technologies to the individual level, and again, using our machine learning platform to fine-tune and refine those experiences for those individuals so that they receive the best benefit and continue to be engaged. The platform is using clinically validated methods of the Papworth-Benson breathing exercises, as well as identified mindfulness technologies. And it is focused on, right now, with a partnership that we have with AXA, which is another insurance carrier in Europe. And they're currently piloting this with 500 of their patients that they insure right now. So I'd like to give you a demonstration of that as well. So if we can switch back over again to the VGA. So the app is set up to allow you to use this app a number of times a day and then be able to track the benefits that you're receiving from it over time. Again, in this situation, the demo is going to be capturing my heart rate through the camera on the phone. So we can start the app. It's going to ask kind of how am I feeling in the moment. I can answer that question. And then it asks me to comfortably hold the phone, place my finger in a position where I can get a good reading of my pulse and heart rate variability. And then it's going to coach me both visually and through the audio to inhale and exhale at the pace that will trigger a vagal nerve response in the body, which causes a release of Pitocin and a natural way of relaxing the body, moving from autonomic to parasympathetic nervous system. Probably not going to have the best outcomes right now, publicly speaking, but you can understand how the platform works. And this can also be coupled then with wearables, things like the Samsung Gear products or the Microsoft Band. Did we lose it again? Oh, sorry, thank you. Where they're able to passively capture this cardiac information. Okay. So what's nice about the platform is we've built a number of applications and a number of different interventions that are all based on the same cloud machine learning platform. But there's still a lot of variability in the wearables that are in the market currently. And so we wanted to be able to capture more clinical data in order to be able to start studying this application more closely, as well as capture more accurate data. So we decided to create a device that we call the breathing stone. And so I have the device here. The idea of it is to provide a breathing coaching device that has actually almost no user interface. So it was very instinctual, that it didn't require an individual to have someone coaching them directly in the room with them, and to use these methods. So I'll start this up here, and while we're waiting for it to get going, it uses the same methodology in breathing, but we're using light and sound again to do the coaching as opposed to visualizations. It has 2 pads on the back, so these, as they're held in my palms of my hands, are actually going to capture an EKG signal from my heart. And this information, too, is passed on through Bluetooth to a charging base, where that information is then analyzed by our cloud system and then pushed back an intervention that's most appropriate to an individual, looking at what their heart responds to. So the idea is that as you breathe, the colors are going to change to represent the changes that your heart is going through, increasing the amount of dynamicism in the heart rate variability, and also that you're following the correct patterns for breathing. So right now, the device is actually being piloted with Chelsea and Westminster hospitals in the UK. They're using it in their pediatric burn unit. They're using it as well in their geriatric day rooms for people suffering from dementia and anxiety. And they are also focused on preoperative and postoperative relaxation techniques with this. The device is also being used in pilot by Kaiser Permanente Southern California Innovation Lab, and they're looking at other applications including PTSD treatment, ADHD in children, as well as labor and delivery applications. So instead of having to require an individual that is specialized in coaching or training this person, it's allowed to be really an individual experience that you can actually see improvements over time. So that is really the core of BioBeat's focus. And the beauty is we can continue to expand applications and capture data from more and more sensors as they become more mainstream. But the learning process is one that's happening continuously, and we hope to be able to really have a chance to improve the quality of life of individuals by reducing stress. Thank you.